and institutional support in helping mothers nurture the future. In commemoration of this international movement, we're excited to present the NTA Lagos Baby Show featuring drama, health, games, quiz, and the highlights of the day is a baby show contest. To participate, mothers with babies exclusively breastfed from 0 to 6 months are invited. Pick up a registration form at the programs department. Date Tuesday, August 5th, time 10 a.m. prompt. Venue NTA Lagos Channel 10 premises, Tejo Shoyaba, Lagos. For inquiries, please call the following numbers. Breastfeeding, a mother's priceless gift to her baby.
Are you looking for a spacious, serene, beautiful and comfortable environment for your event? Then
NTA Lagos Channel 10 premises is the place to be. With about 3,065 seating capacity,
NTA Lagos Channel 10 premises provides a well-secured land and car parking lot for your wedding receptions, birthday parties, religious and school activities.
our conference hall is convenient for company annual general meetings, lectures, seminars or workshops, with just 200,000 naira only.
You can use our entire space and also have your event covered with a token which will be aired on our social diary program, Mary Lane.
For more inquiries, please contact our marketing department, NTA Lagos Channel 10, Tejo Show, or call Chibuzo
On 0812 324 5519
and Gmo.
on 003 830 1669.
NTA Lagos premises affordable just for you.
Hello and welcome to another interesting episode of Health Watch. World Hepatitis Day is celebrated globally every 28th of July. This week, as we join the rest of the world, we are creating awareness on this disease. And on this edition, we're able to speak with Toby Adegbami, a public health expert and the head of marketing and strategy vaccines of Emzo Pharmaceuticals. He'll be sharing with us what Emzo Pharmaceuticals is doing this week to celebrate World Hepatitis Day, and also highlighting the causes, the signs and symptoms, and of course how to manage this disease. Plus, we have a short report on how to protect yourself this cold period. All right, we're expecting that it should rain, all right, but it's not raining. We're having more of cold in the mornings and in the evenings, and we'll put this short report to equip you on how to take care of yourself this period. All right, my name is Nkem Okibe, and you know how I love to do this with you every week. We'll go on a short break. When we return, we'll now join the interview with Toby Adegbami. Stay with us. Health Watch continues in a moment. If you're just joining us, the program is Health Watch, reaching you from the station of excellence, NTA Lagos Channel 10. And like I said, this week we're talking about hepatitis. As you all know, World Hepatitis Day was celebrated on the 28th to create awareness on this disease. Okay, and with me is Toby Adegbami. He's the public health expert and also the head of marketing and strategy vaccines for Emzo Pharmaceuticals. You're welcome to Health Watch.
Thank you very much for having me.
All right, we're talking about World Hepatitis Day. I think it's important that we look at what's the definition of hepatitis. What would you say it is?
Okay, so hepatitis itself, it's simple. It means the inflammation of the liver.
Okay.
All right, and when that happens, it's the liver starts expanding. There's some scarring of the liver, and then it leads to liver cirrhosis, then liver cancer, then ultimately death. No, so hepatitis attacks or affects the liver.
So what are the causes?
Okay, so liver inflammation could be caused by several factors, which include excessive consumption of alcohol and excessive smoking. All those could affect the liver. But when it comes to hepatitis virus, which also affects the liver, there are 5 different strains: hepatitis A, hepatitis B, C, D, and E. Okay. Now, in this part of the world, the most deadly and the most common are hepatitis B and C. Also, most of our awareness efforts are focused on those two. Hepatitis B, as of today, has a vaccine, so it is completely or totally preventable by simple action of just getting tested and getting vaccinated. Right? Hepatitis C does not have any available vaccines right now, but there's treatment. Okay. Now, hepatitis B has some treatments or management, but there's no exact cure for it right now. So most people will most likely live with it for a lifetime, but it can be managed reasonably well so that it's not transmitted or transferred to partners or friends and family living around them. So there's no point, there's no need to stigmatize hepatitis because it can be managed and it can be prevented. All it takes is for individuals to take action and know. Now, if you don't know, you can't do anything about it. And hepatitis is called a silent killer for a reason, because it can be in the system of the host for so many years. While it's attacking the liver and it's causing the damages, it's there, you don't know, you're living your life normally, and then all of a sudden, everything starts happening at the same time, because the liver is just one, and it's one of the most important organs of the body. All right, and when the liver is gone, we are just counting time. So the awareness for hepatitis is very important, because people need the knowledge, they need to take action, but without taking any step, or without running the test at the very minimum, you can't take any action for prevention or treatment. Now, I would say that the hepatitis vaccine was introduced in Nigeria since 2004.
Okay.
So I can say that as of now, it is actually a prerequisite for almost every newborn baby to be vaccinated within 24 hours of birth.
So has it been implemented that when the child is born, the child should take at least in the next 24 hours? Within 24 hours. Okay.
It's called zero dose.
Zero dose.
Zero dose. Hepatitis zero dose needs to be given within 24 hours.
Okay.
All right. And while the child takes other vaccines growing up, they will still take some additional doses, all right, of hepatitis vaccine. So for children, I think it's been reasonably covered with the National Primary Health Care Board plan, and but for adults that were born before 2004, and I also say, even though it was introduced in 2004, it also doesn't mean that the awareness was everywhere. We know these things. When you introduce something, it takes a while before everybody get accustomed to it. Some people question it. Some people want to wait and let others take it and see if anything will happen before allowing their own children take. So even though it was introduced in 2004, it doesn't mean that everybody born in that period really took the vaccine.
Okay.
All right. So it is important to check vaccination history and be sure. And in case where you are not sure or you cannot find the vaccination card, WHO recommends that the person should be vaccinated again. and there's no downside to vaccinating again.
Okay.
So what we want to ensure is protection. So why not ensure that you're 100%, leaving nothing to doubt? Why not ensure that you are 100% protected?
For this week, I'm sure that EMSO is putting up something very special. I want to talk about it. What is EMSO doing to, of course, create more awareness on the World Hepatitis Day? That's what we should be doing, all right?
Yeah.
So let's talk about it.
Okay, so we are running several partnership awareness events with different healthcare providers, hospitals, pharmacies, even with state ministry of health. We are working, doing a lot of press conferences, a lot of interviews like this and all of that. So we are, even on our social media pages, we are doing all of that to create awareness, because we think that the awareness level is poor.
Okay.
All right. Because it is a silent killer. It's unlike the other diseases where you start seeing signs and symptoms very quickly. It can be there for so many years, and at the point of onset of signs and symptoms means that things have really degenerated. So there's almost no coming back from there. Okay, so that's why every preventive action that needs to be taken needs to be done early enough. Okay, so for us, we are doing a lot of awareness. We are doing some health outreaches too, like I mentioned, in partnership with some NGOs, hospitals, pharmacy shops, Ministry of Health in some places, even some religious bodies. So we're holding several. And basically that's
So
what
all of
we're
this is
doing.
happening this week?
Some of them are happening this week, some of them depending on the partner.
Okay.
Some of them have pushed it till later. Some of them even happened last week.
Okay.
So depending on the partner and their own schedule. So we are flexible. So as much as possible, the goal is very clear to reach out to people, to screen more, vaccinate more, get more people to be aware and take self-informed decisions as concerning protection against hepatitis. So it's basically.
So when you say partnering, what role is EMSO playing, and how do you get to far to reach areas? When you say social media, not everybody's on social media, not everybody's watching us right now. How do you get to places that are far to reach? Because when we say immunization, vaccination, what the common man wants to hear is it free? Once it's free, everybody gets to it. Where can I get? Is it accessible? So what is EMSO's role in that regard?
Okay, so what we have been doing is, number one, is engagement. All right, we've been engaging on the state level, on the private hospital level, pharmacy level. We've been engaging all the stakeholders there, asking everyone to do more. All right, so yesterday there was a training for healthcare workers with Ogun State Ministry of Health. All right, EMSO also is in partnership with them as concerning that. Yesterday we also had a different webinar for pharmacists.
Okay.
Yeah, so that they can know what to do, how to plug into our partnership, and also like a refresher course on hepatitis. So we ran that yesterday, but for most of the screening and most of the outreaches happening, we are making screening kits available for free. So we know that one of the barriers to taking the vaccine is the knowledge, not knowing. So our GMD magnanimously said, okay, let's take care of this. So averagely, almost throughout the year, we always have screening kits available. So anywhere where any outreach needs to be held on hepatitis and they reach out to us, we make screening kits available, and then depending on the organizations, we also try and make sure that the vaccines are also available at a very reasonable price. All right. So for us, is getting this message of prevention to the last user. That's what is important. So every avenue that we can, some NGOs work with us, and depending on the target audience for the NGOs, we also run some partnership with them to be able to reach such people. So I might want to talk about the far to reach areas, but you'll be shocked that the people living around us, the elites, the well-educated, several of them know nothing of hepatitis.
Okay.
I'd seen it happen. So one of the planning programs where one of the NGOs really wanted to reach out to, and I then asked that, see, where we are right now, there's a high chance that 60 to 70% of people here don't even know anything about hepatitis. And these people are learned. These people can afford to pay for vaccines, but they still don't know. So she said, okay, let's do this. And then we did that. We put people together, add some form of awareness, and you'll be shocked. Almost everybody, and in just a few pocket of people here and there, have taken the hepatitis shots before, have done screening before, or maybe a situation first did. Maybe a family member got exposed. I know most people act as a response to something that has happened.
Okay.
Oh, so they just diagnosed my dad of hepatitis, so everybody screen and see if you are fine. People get vaccinated before. So we just don't want to be reactive. We want to be proactive, and that's how we can ensure that the larger population is protected from hepatitis.
Okay, while we create this awareness, it's also important we talk about the signs and symptoms to look out for, because you'd have noticed that a lot of people in this climb do not just go to the hospital. They want to see something is wrong before they get to the hospital. So we have a lot of people doing self-medication, indulging in self-medication. They don't want to get to the hospital. So are there signs that once you have the signs, you need to see your doctor, or of course that brings that concern to you that something is wrong? So talk about it.
Okay. So I know I mentioned something like that earlier, but I'm just going to state it very clearly that when it gets to the point where we are looking out for signs and symptoms for hepatitis, it is already too late.
Okay.
All right. General yellowing of the eye, that's very related to jaundice. You see that physically, general body weakness. So it's giving you the vibe of almost every other popular disease so you might not be able to pinpoint that it's hepatitis unless you run the test for hepatitis. I know someone that was treating everything else and then she wasn't getting well, and then they were like, okay, let's just run a full body, and then they ran several tests until it was figured out it was hepatitis. So for hepatitis, we cannot afford to wait. Okay, so the delay is very dangerous. It's very dangerous. So it is important to get screened, get protected, put your mind to rest. I know that, oh, I'm fine. In case you get exposed in the future, I'm already fully vaccinated.
So aside from this, how often are we expected to do the screening, like do the test?
So if you get vaccinated, you don't need to. If you just keep your vaccination record intact.
Okay.
So as soon as you do the test and you're negative, you'll be recommended for vaccination. If you do the test and you're positive, there will be some further analysis to do, all right, and then you then have to see a specialist to get your treatment started, all right. Once you screen, you are vaccinated. There's no need repeating the test over and over again because you are fully vaccinated. Okay. Right? But if there are needs, like the food handlers now, it's one of the regulatory prerequisites for them to run hepatitis tests every 6 months.
Okay.
All right. So vaccinated or not vaccinated, everybody run the test. So that. But if that is not the case, you don't need to keep running hepatitis tests.
So you know that when we say vaccination, we expect that the vaccine should protect you entirely. Yes. But we see cases where you get vaccinated and you still come down with that illness. What happens in that case?
Okay, so it's also important to state that it is not, when you come down, it's not very popular. All right, there will be few cases like that. Okay. Now, when that happens, this is how to say it. The vaccines must have triggered some antibiotic reaction, all right? And then so the word should be immunogenic reactions, not antibiotic. It must have triggered some immunogenic reaction, all right? Okay. Getting the body system to produce antibodies against the illness or against the disease. Now, the thing is, when it seems like the body is coming down with such disease, and I think it's probably for vaccines like maybe chickenpox or that for measles, and it's just that the vaccines, the effect you would have experienced without vaccination will be a lot more serious or severe. So the vaccine ensures that even if you come down, it is very mild. So basically, but in most cases, the vaccines generally prevent. So sometimes when that happened, maybe the person has been pre-exposed, because I don't think for such infections you don't run tests for chickenpox or measles most times before you give the individual, because it's not a prerequisite. Unlike hepatitis, where it is a prerequisite. If you are already exposed, we cannot vaccinate you. But if you are not exposed, when we confirm that you're negative, you get the vaccine. Okay. So it's for hepatitis, it's more, we are sure. Unlike the chickenpox, and we hardly run those tests prior to the vaccination. So there's a possibility of if there had been some pre-exposure. But the vaccine will definitely ensure that the reaction is a lot milder than it would have been without vaccination.
Right, fantastic. On a short break, when we return, Health Watch continues in a moment. Stay with us. If you're just joining us, the program is still Health Watch, and we're talking about hepatitis in celebration of World Hepatitis Day. On the show, I still have with me Toby Adegbami, Head of Marketing and Strategy Vaccines, Emzo Pharmaceuticals, and is also a public health expert. Before we went on the break, you said a whole lot on the awareness that has been going on. You were able to also talk about types of hepatitis, the symptoms, the signs. So very, very quickly, in 2 minutes, what would you say are the ways to manage hepatitis? Because you said manage and good enough. You also mentioned treatment, so you can be treated. So you're going to be telling us how to manage this disease and how families, loved ones can support whoever is living with this ailment.
So ways which one can contract hepatitis is majorly through body fluids. All right, for people that share sharp objects, and from mother to child. So that's so a pregnant mother, if the child, there are precautionary measures you could take at birth. Take hepatitis B immunoglobulin, that's freshly prepared antibody serum that will. That's post-exposure, and then get vaccinated again. Okay. All right, so either that, or if the mother does not do anything at childbirth or within 24 hours after birth, and the mother is hepatitis positive, it will pass it down to the child. And for some people who have been living with it all their lives, they never knew. Okay, so if sharp objects through sex, almost the same way that HIV is transmitted. Okay. All right. So the only difference is hepatitis virus can stay on an open surface for, I think, days, several days, maybe up to 9 days. Yeah. But unlike HIV, in a few hours, it's dead and all of that. So in case you get a body cut and then you come in contact with where an infected blood has been dropped in, the virus can regenerate itself in the body system. So why why they say it's a silent killer. All right. So the most important thing to do when there's an hepatitis positive person around you is number one, don't panic. Okay. It is preventable for you. Okay. So what we need to do at that point is run some tests immediately. Be sure. In fact, now most church marriages, aside HIV, you must do hepatitis test to be sure. All right. If you are the one that have people coming to live with you, I think it's one of the tests that you have to do. You are getting a maid or a distant relative is coming and staying for a while with the family. I think those things are important to know. In as much as one is screened and one is vaccinated, one is protected. Okay. All right. But if that is not the case, the management of it is, I mentioned earlier that there's no exact cure now, but it could be managed. Okay. All right. So the management takes several years, some people a lifetime. All right. So you just be seeing your gastroenterologist as much as possible. They will, of course, they will set appointment dates, and then they can run several tests. And with your commitment or dedicated usage of the drugs, all right, you can also run several tests years later to see what the viral load looks like. That's why it can be effectively managed if the information is available, if you know, can take action.
All right, thank you so much, Toby Adegbami, Head of Marketing and Strategy Vaccines, Emzo Pharmaceuticals, and is also a public health expert. I hope I'll see your name very soon, Doctor, because this was really a bumper package, very enlightening. Thank you so much for coming on the program.
Thank you very much, ma. I appreciate you.
Moving on, we'll take this short report on how to protect yourself during this cold weather. You agree with me that it's not been raining, but the kind of cold we experience in the mornings and in the evening is something that you need to really find out how to equip yourself this period. Let's go on this short report. We'll be right back. Stay with us. The rainy season in Nigeria typically occurs between April and October. During this period, the skies are mostly cloudy and we get lots of rainfall with a breath of freshness and coolness of the weather, which is a relief from the scorching heat. However, in recent times, Lagosians have observed a noticeable change in the usual pattern of rainfall. Instead of the frequent heavy showers expected this time of the year, there has been a reduction in rainfall, replaced with a lot of cold, particularly in the early mornings and late evenings. While this coolness is a welcome change for many, it also poses some health concerns such as cough, catarrh, flu, chest congestion, and the likes. How do you protect yourself this period?
So during this cold weather, especially in children, warm water is very important to bathe them in the morning. Then these thick clothes, you dress them according to the weather. So they have to wear cotton inside, then they wear their pullover on top. Then those that are sensitive to cold weather, then the use of face masks, very important because of this weather, the environment we are in now. There's no just special food like that, but let your food be warm. Let it be warm during this season. Avoid cold drinks. Cold drinks is not good. It's not advisable during this season, during this weather like this. Then the intake of fruits, especially oranges, citrus fruits, that has vitamin C, increase intake of vitamin C, then steam inhalation, bathing of warm water. That is what we can do so that we prevent all these respiratory tract infections.
With these simple tips, you'll be able to cope with the cold weather. It is recommended you seek medical attention whenever you experience persistent symptoms. Stay warm and stay healthy. And that's the much we can take on this week's edition of Health Watch. Remember that I normally say health conscious people live longer. You have questions, you want to make inquiries, you'd like to sponsor this program so that we can do this together every week. Send us a mail on okivenkem@gmail.com or send a message alone to 07060865487. Remember, hepatitis has no cure. Take care of yourself, get screened, take care of your loved ones or your friends, whoever you know around you that is living with hepatitis. Please show some love and support. All we can always say is make sure if you feel anything, you see any sign, get medical attention, see your doctor. My name is Nkem Okibe. Thank you for being part of this week's edition. See you next week.
Mothers, are you ready?
Happiness, now your cup of tea.
Join NTA Lagos Channel 10 as we celebrate World Breastfeeding Week 2025 from August 1st to 7th. A global initiative by WABA to promote and support breastfeeding for a healthier and stronger generation. This year's theme: prioritize breastfeeding, create sustainable support system, underscoring the vital role of community and institutional support in helping mothers nurture the future. In commemoration of this international movement, we're excited to present the NTA Lagos Baby Show, featuring drama, health talk, games, quiz, and the highlights of the day baby show contest. To participate, Mothers with babies exclusively breastfed from 0 to 6 months are invited. Pick up your form at the Programs Department. Date, Tuesday, August 5th. Time, 10 a.m. prompt. Venue, NTA Lagos Channel 10 premises, Tejusho Yabale. Guest speakers, Vera Chikeze Oke, clinical sexologist. Chubueze Obiwanne, co-founder Milk Booster. Pharmacist Oge Moma, Lean Edge Pharmaceuticals. For inquiries, please call. Breastfeeding, a mother's priceless gift to her baby. Supported by